Hi, I'm Dr. Rachel Kennedy at Highland Park Animal Hospital, and I am going to talk to y'all today about dog abdominal ultrasound.
Dr. Kennedy, what types of conditions or concerns typically require an ultrasound for dogs?
Yeah, there's kind of two categories. We can definitely do surveying ultrasounds, which is when we know there's something wrong, but we can't quite identify it. A lot of times imaging the abdomen is our logical next step. Or it can be more specific. So we are suspecting internal hemorrhage, something like that. We're going to be looking for bleeding fluid in the abdomen. So it's a very broad test that can be done. We look at a lot of different body systems and a lot of different organs while we're doing it. So there's kind of two categories there.
How does a dog ultrasound differ from other imaging methods like x-rays?
Yeah, without getting too technical, x-rays basically look at a silhouette of the organs. They can be great for identifying foreign objects, obviously great at looking at musculoskeletal health, but ultrasound allows us to actually look at the architecture of individual organs, so the wall of the intestine or the wall of the bladder, versus x-ray just gives us a silhouette of that organ, so you don't always see the internal structure of it. So they both have their places in veterinary medicine, but generally if you're wanting to interrogate an organ specifically, ultrasound is a superior method to do so.
What should pet owners expect during a canine ultrasound appointment?
The way that we structure ours, there's two important things. We do like the pets to be fasted, have an empty stomach. It makes our imaging quality better. And then we generally have them drop off for a few hours the morning of. The way that we do them, we don't normally have owners present, but it generally just takes a few hours. The reason for the empty stomach also, occasionally dogs need to be lightly sedated to stay still for it and get your money's worth of your ultrasound. So that's generally how we schedule them. It varies a little bit by specific need though.
What can an abdominal ultrasound reveal about a dog's health?
It kind of goes back to the previous question. There's kind of two categories. We can be looking for something very specific or generally surveying things, but it's a very important tool in our toolbox. There's kind of an endless list of things that can be diagnosed on ultrasound. So without getting too in the weeds about it, it's generally a form of structural abnormality in the organ that can relate to underlying pathology or disease.
What's the process for a cardiac ultrasound in dogs, and when is it recommended?
Yeah, we didn't really get into chest ultrasound, but we do have a doctor here that does echocardiograms, which is a ultrasound of the heart. We generally will do those for dogs that have a new or worsening heart murmur, a dog that demonstrates an arrhythmia on physical exam, or a dog that's demonstrating cardiac signs like a cough, collapse, things like that. It's a great way to look at cardiac function. Again, x-rays are limited in the way that they examine the heart. So those are generally our biggest tools. We also will sometimes do lung ultrasound. That can be looking for fluid, pneumonia, that sort of thing, but x-rays can also be helpful for that as well.
Are there any special preparations needed before a dog receives an ultrasound?
Fasting. It makes a huge difference. It gets your money's worth. That way we can sedate if we need to, and we can see all of the organs without having a bunch of food in the way.
Can you explain the benefits of using ultrasound for detecting internal conditions like bladder issues or liver disease?
Yeah, again, this looks at the structure of the organ. So if you imagine an x-ray, it just shows the silhouette of the organ versus ultrasound. You can really see the architecture. You can see the different parts of that organ. For example, I can look at the gallbladder, which is hidden within the liver. I can look at the portal veins, which are hidden within the liver, just not something you can examine on a radiograph. Bladder, same thing. I can look at bladder wall thickness, I can look for stones, I can look for masses. All of that is missed a lot of times on radiograph. Thanks for listening. So if you have any questions or you feel that your dog would be a good candidate for an ultrasound, give us a call. We do require a consultation, but that's just to make sure that it's going to be the best modality of imaging for your pet. But please give us a call or schedule a consultation if you have questions.